Hello, I'm David Byes, your MSU Extension State Health Specialist, back with you in our conversations about COVID-19. I'm here today with the president of the Oktibbeha County Branch of the NAACP, Yulanda Haddix, and while we're going to talk about COVID-19 and its impact on the African American community in our state, while the organization's name, the National Association for the Advancement of Colored People, does refer to colored people, Yulanda has suggested we use the term African American. And we recognize that some folks prefer Black or people of color or references to specific countries of origin. But for today, we're just going to use African American to be consistent throughout our discussion. And viewers, I want to let you all know that because of the very critical nature of this issue, we're going to take a little longer than our usual broadcast. So if you've got to sign off early, we certainly understand. But we do hope you'll be able to come back and listen to some of the great insights that Yulanda will give us today as we move through this conversation. Yulanda, thanks for joining us. Thanks so much for joining us today.
I'm truly honored to be here.
So, Yulanda, we're seeing in Mississippi and nationwide a disproportionate rate of infection and death from COVID-19 among African American people. Across the country, the statistics are showing that rates are just extraordinarily higher than they are for white people. And in Mississippi, the rates are, equally alarming. So what are some of the reasons that you think that's going on, that's happening?
Well, Dave, I think there are, a number of issues, but to begin with, 1 in 5 African-American people, when another country says we can telework from home to start with, most of us can't telework from home because we don't have those type jobs. Also, we live in generational housing, which means that we live with parents, grandparents, mother and father. We all live together. So a group of us live home. We're in and out of the homes. Also, they say we need to wash our hands to start with, to keep our hands washed. And 30% of our homes, 30% of our African Americans live in homes that do not have running water. Also, we come with abundance of underlying issues, high blood pressure, diabetes, things that are underlying issues. And then COVID-19 impact those. It's kind of like add to those underlying issues. So those are reasons that impact our community. So when you come with a baggage of already underlying issues and you add COVID-19 on top of that, that impacts our community. With disparities in healthcare, we already have issues with healthcare. That's another reason why it's affecting our community at a high rate. So that's just to name a few.
Well, that is really heartbreaking, and I just kind of leaves me speechless even to hear this. It's saddening, really. Can you describe some of the ranges of responses to the COVID-19 pandemic that you've seen across the community in the state, and what changes have you seen in responses as it's unfolded, as the crisis has unfolded?
I tell you what, the reason COVID-19 has not been really receptive in our community, and the reason why, because our leadership, because the information has been so diluted, we have not, our leadership have not been able to give us correct information. We get information, first started out saying that it was affected only the elderly. And then it comes back and says it affects young generation. Then it says the information goes back and forth, so we're not receiving correct information. And then we also have to say, we see that our healthcare, you have to call in to get tested. You have to have these symptoms before you call the doctor. You can't go in. Most of us do not have adequate health insurance or don't have any health insurance. So we don't have primary care physicians. So we don't have a doctor to call if we have those symptoms. So we're not able to go to the healthcare facilities. Also, we need trusted leaderships and trusted leaders in the community. So if our trusted leaders are not at the table where the information is being given, then we don't have the correct information to have. So if I don't have the information I need, the correct information to go on, so I don't trust the information that's being out there. So because it's diluted, then I don't understand what's really going on. Also, I looked at the availability of test sites. Where are they? Me as an educator, and I'm pretty much familiar with what goes on, I read and knowledgeable, I know of a test site in Oktibbeha County. We just take the state of Mississippi. In my town, I know of a test site, but I think of the people who are not as knowledgeable as I am, they need to go look for the test site. Also, there's so many myths and facts. Most of the information that's given is given from third parties. Someone told me that someone said this. So the information that's being, I say, is diluted. So by the time it reaches the person, that the factual information is never given to the correct person. So that's probably one of the reasons that we have the issues we have in our community. So we don't have enough information that's correct. And then the individual who should be giving us the correct information is not given. Even our medical professions, when I speak to people in the community, I say, you should be masked and gloved. They'll say, well, my doctor said if I take a vitamin C. My other doctor said if I just stay home. My other doctor said if you're healthy, you're not going to get it. So the information is not, we don't have consistent information within the medical profession field. So that is the reason why we're not so, I would say we're not so accepting of receiving information now, because if there's so many myths about what we should be doing and what we should be accepting, that we're not so sure what's the correct or not so correct information. And that's why we have such a difficult time receiving it.
Right. Yeah, definitely inconsistent messages across the board. And that is that's a real problem. So that's very helpful information, very helpful insight. And you hit on this question a little bit, but tell me what is specifically what effect do you think the pandemic is having on the African American community, and maybe more specifically the stay-at-home order? That's been an interesting twist in all this. That's a bit different from other pandemic or other illnesses we've seen with this mass stay-at-home order. So talk to us about how that's affecting African American communities.
I can say positive, negative. The positive effect it has on is that now it's actually sharing line the fact that there is because of the effect of poverty and disparities in education, then we realize now that the people who already had issues as far as medical treatment and poverty and not able to get the food and the things they need, then there's a major issue. And so I heard our Secretary General John Adams says that there's already so many barriers before COVID-19 came about. Now it's just exacerbating the problems. Also, the stay-at-home order, you would say, okay, you stay home, but then if my mate has to go to work, so he has to go out there and work, but you expect me to stay home. So I'm looking and say, okay, if stay-at-home order is supposed to apply to the entire family, then you saying that one has to go, so the one who has to go to work, he's considered the essential employee, so he has to go out there. He's exposed COVID-19, not required to wear a mask, because a mask is not we want everyone to have a mask, but there it's not readily supplied to everyone. So he's out there working. He's come back to my home. I need to go to the grocery store, and I just know when I go to the grocery stores and to the shopping essential places I should be going to, our employers are not mandating their workers to wear a mask or supply them with masks. So we look at that and say, well, we have the stay-at-home order. I think is the best thing happening, but it has to be across the board. That it is either a requirement or it has to be, I would say, communicated that we all should obey that, because I think for some it applies to them, and some and other is not. And the ones who are not as fortunate to have the ability to stay home, then they're out there being exposed. And I look at the large companies or industries who just recently, some of them just closed down, I'll say, or let the employees out. They were able to keep their doors open with 3 or 400 workers there. And then you hear that, okay, I only closed my doors because someone was tested positive. But then other organizations say, okay, we know there's an issue here, so we're gonna shut our company down. And I can go back and say that I went to, in March, the first week in March, we went to the March on Selma. The COVID-19 was out here, but we had no information. It was not, even discussed that this could be an issue, could be transmitted this way, just wouldn't even include. And those are things we talk about. You said we stay at home order now, but does it apply to the entire community or just to certain people? And that's why I think those mixed messages are causing a problem for us. But I think the stay-at-home order is like the best thing we can have. I think it's going to be our life-saving tool, but it has to be communicated to all communities.
So kind of going along with this idea of communication, getting the right information and consistent messages out, talk to me about who you see as the most trusted sources of information in the African American community. I mean, essentially, I want to know what can we do? What can what can I do to help get the right information out? Who do we need to get the information to then get it out?
Well, I really believe, I always say trust the leaders, but I always say people who look like us or know the people who we can trust, or people who have relationship with. I'm not going to say you need all African Americans to talk to African Americans, but people who you trust. My primary care physician, or the people who I communicate with, the people at the store, the people who I work with. These are people who I have built relationships with. These are ones who I trust. I value what they say, and when I communicate with them and I understand that what they say, they're gonna have my best interest in mind. Those are the ones who need to be communicating with me. And so you can't bring someone in who just talks on a TV screen and say, I'm gonna give you this information, because there's no relationship building. So we need to have people in our community who knows us, who can talk to us, or they're the ones who can get in contact with the people who know the people, can tell those people. Because I tell you, if we don't have a relationship or know those people, we're not going to believe what they tell us.
That's a helpful reminder. Relationships matter so much in the Deep South, especially. And then to hear you emphasize how important it is in the African American community, that's a good reminder that we can't just assume, because as you said, get on a TV screen or put a pamphlet out or get on the radio, that it's gonna get the word out. So thanks for sharing that reminder as well. What messages do you think are most persuasive or compelling about the COVID-19 pandemic?
I think, well, I'm sorry. What we have to say is that let them know that everyone could be a carrier. And I was listening to John Adams, our Surgeon General, again. It says that there's about 20% of us who are really affected and may be hospitalized. The other 80% are in quarantine, who could possibly be a carrier and may show very mild signs. And these are the ones who may be home with the depression or the mental illness, or just be at home. But we all could be a possible carrier, and we need to know that, because I think even when I speak to people, they'll say, "Well, I'm gonna pray about it," or "I don't have the sign, because I may just have the cough, or I just may have this little shortness of breath, but I don't have a fever." We must understand that you may not get all three of the signs, but you can actually be a carrier. And also, if I'm exposing my 99-year-old grandmother or my 70-year-old mother, she may have those underlying issues that may affect her and may actually kill her. And so I think what it is just the education, letting people know that we all are possible carriers, and we must understand that it's not us. It could be the next person besides that we can actually be affecting them. And then I think that it's the hardest thing to let people know. They say, "Well, I'm not sick," but it's not you. You have to worry about it's you, your children, your family members, and the people next door, or the person in the grocery store. It could be anyone, even your pet. So we just never know.
Yeah. Well, I'm reminded when you say that of some when I've done quite a bit of reading on COVID-19, and I saw just a really good, insightful, incisive, quick kind of tidbit, and that is that when we see numbers announced today for COVID-19 new infections today, those really represent people who were infected 5, 7, 10, maybe even 14 days ago. They're not people who just got infected today. They're people who just found out today that they're infected. So that's your point about us conveying that we can be carriers even if we don't have symptoms is a really, really good reminder for us as well. Are there any particular types of messages that you would say don't work, or that we need to avoid, or we hear about, maybe avoiding scare tactics, or what kind of messages do we need to stay away from?
Well, I think when I was telling people, we always say, "Well, you're gonna die," and I think I'm in the African American community, and I was in the Black community. We know we're taught that we have faith in God, and I'm a true believer. I'm a born again Christian, and we believe that God has the last say. And a lot of our religious leaders say that God's the last say, no matter what happened, He has you. But we also know that we have wisdom also, and we have to realize that things happen. I believe that God allows things to happen. We also have to have wisdom and knows that when He also gives men knowledge and give doctors knowledge, we must listen to what the medical profession say and follow heed. Such if you don't do it for yourself, you must do it for the people in your community. And I think what happens that We have to listen and be educated. But we don't tell people you do just do what I tell you to do. We must educate them also the reason why they're doing it. And that's key to let them know, I'm not telling you to do this because I want you to do this. I want you to understand the reason you're doing this. It's not so much as for you, it's for the people who's going to be affected by the things you're doing. You look at the numbers, make sure you let them know the numbers, the things that's going on. I said a family, my sister-in-law, her mother-in-law, sister-in-law, and a brother-in-law, they all died from COVID-19. But she's still on the community. I said, well, after all that, but it has to hit home. So we must let them know that, yes, we're Christians and we know that God has control of everything, but you have to also be educated on the reason things are going on. That's the one thing we have to tell our community. We can't just say you're going to just die. That doesn't work. But we have to also say that you have to be educated on the reason things are happening the way they are. And also we have to let them know also that our leaders don't know everything. It's a working process. So I think that's one thing that people say, well, one doctor said this other doctor said this. I said, it's all a learning curve. So there's no cure. They're still working on the vaccine. And I think that's a mixed message also, because they say, well, and the test, you may get tested Monday, you may be negative, and you go back a week later, you may be positive. So there's no really direct link to when you're going to be tested. You can get COVID-19 next week or 2 weeks from now. So we can't say we're totally out of the woods until this curve is totally flat.
Right. Wow, there's so many moving parts, and you're exactly right about the information changing just by the hour almost. And but I'm also struck by the reminder that we need to give people a good piece of the picture. We don't just need to give them a snippet of information and expect them to do what we say because we said it. I think that's part of respecting the dignity of all people, is that they've got a mind too. They deserve to know the why as well as the what. And I appreciate being prompted to think about that again. So thanks for bringing that point forward. And that's something I'll definitely take away from our conversation. Yulanda, we've talked a lot about information sharing and getting the right information out to the right people, to get it disseminated, using trusted sources, those kinds of things. And we know that information is important, but it's not sufficient to change this. It's not all that we need, is what I mean by that, to change this current set of circumstances. So how can stronger relationships between all members of community overcome the barriers to information and access to health and healthcare, and reducing the disparities? And really, I guess what I'm really asking, I'm sorry to kind of be all over the place, but beyond just information sharing, what needs to happen to make movement on this critical issue?
I think that we need to realize that every community comes with its own unique set of issues. And I think that you need to have people from different communities at the table. I think what happens that, and say, for instance, with information that David Byes get, I should also get the same information, but I need to understand also who the community I'm working with. So, because I know people used to say, at the very beginning, when COVID-19 started, they say, well, it didn't affect the Afro-American community or the Black.
Folks, bear with us for a second. It looks like we've lost Yulanda. She's with all the storms, we've got some issues with connections maybe, and that could be what's kicked her off. So just bear with us for a second. I apologize. Hey y'all, we're back. I apologize for the technical glitches. If COVID-19 wasn't enough, then we had to have a round of tornadoes yesterday that seemed to disrupt our infrastructure. So we're back. Yulanda, please carry on with that conversation. We were talking about some of the things that we need to do beyond information sharing. So go back into some of the things you were saying.
Okay, we were saying the things that I guess will create sharing how barriers of our community. And I was saying that each community brings its own set of unique problems or issues. And I think what happens that we're we invite people to the table. We make sure we invite all community leaders to the table. However, we need to consider the uniqueness of each community issues. So I would say you inviting people from communities that already have barriers with education and poverty, to make sure when you're allocating, I say ideas or projects or doing something special for that community, to consider the fact that they already come with barriers. And so you make sure you allocate something different to that community. And that's why when you, with this issue with the COVID-19 is that the African-American community is being hit so hard because it was already at the bottom of the barrel in the beginning. And then with the COVID-19 kind of impacts the issues. And that's why our community, I think it's at 70% of the African-American community is having such a difficult time with it, because we already have the issue with hypertension, diabetes, high blood pressure, and then you add that also impacts that. And then even with the job market, most of our employees in the community are labor or essential workers, which means they don't have the ability to telework from home, or those jobs to give them the opportunities to be in shelter or work from home. So they have to go out in the workforce, and then they have the opportunity to bring contract COVID-19. And then one thing we do not do, we do not have the availability to get the health care that we should, and we do not trust doctors like we should. So we do not go get tested. So if I have a headache, I'm gonna rely on grandma's portion or things I've had in the past. I would not go to medical profession. And I do not, most of the time, don't have a primary care physician. So I'm not gonna even call a primary care physician. I'm just gonna treat it myself, take my chances. And that's why I excavate in our community so highly.
Wow. So it's complicated. There's a lot of layers that we have to work through to really try to make a difference. And I think you've hit on several messages we would want to share with local officials, but are there any other messages that you wish local officials understood about the needs of different local communities?
I think with local officials, I understand that you have to work with the community leaders who are in the community. I learned as a president of NAACP, I've always learned that you find that who the people in the community who are well drenched in that community, which means that when I go there and I try my best to get involved and I do community activities, I try to find people who have a great relationship with the people who are really, 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 truly need the service. And they know the ones who I can get in contact with and build those relationships. So when you need something done or you need to get information in the community, you can give it to that one person in contact and they can spread it. Our religious leaders are very important, because one thing we do know for a fact, African Americans are really deep rooted in our faith. And I say, because I'll tell people, the struggle is so real that all we have is faith. And that's why it's so difficult to educate us on COVID-19, because you have something that someone has told us it's going to happen to us. We had to battle with the faith issue, because we know that, we rely on God for everything, because that's the only thing we really have. And so when you tell me about when your job lays you off with no income, and then you have no food, there's no bread on the shelf at the store, you have kids at home, the school has ended or postponed or out, and so you have nothing, and all you have is faith. So it's difficult to receive any information from anyone else. That's why it's such a difficult time right now to tell people anything about COVID-19. And so we do rely on our religious leaders to get the information. So it's why it's so important to have them involved in when you're making decisions. And as I tell people, to include people from the community that look like us, and to make sure we are part of the decision making, and then and make sure that's how we can get that information out there. That's why it's so important to do that.
You made a statement. You made a statement that made me think about something I heard a while back, and that's that, and I try to embrace this. You don't wait till you need a relationship to build it. You build the relationship in anticipation that one day, in recognition that we all need each other. And so it's so important for us not to wait till a crisis time like this to bring people to the table. But that's caveated with the idea that it's never too late to bring people to the table.
It's never too late.
Yeah. So I action on that and be sure that I'm being more inclusive and thoughtful about the people I'm getting information. Yulanda, is there anything else you want to leave us with, 2 or 3 kind of key messages, take home points you want us to be sure we think about as we come to the end of our segment together?
You know, I tell you, I think probably the best thing that could have came. I don't know if there's anything good out of COVID-19, but I said the best thing is that it has brought us together as a nation. The affluent has realized that there is poverty and there's disparities in the United States. We must help each other. Also, COVID-19 doesn't have to be our future, so it's going to end. You know, we're going to eventually end as like we had the SARS and those things that came about, and we support each other. So there's a need. I was just this morning that one of the companies was making masks, so everybody's jumping to help each other out. So it's one thing about we have came together as a country. That's one positive thing about it. I think we do. We realize too there's a great need for education. We have to educate people. Because I tell people all the time, I say, listen, if we don't understand, you only do better if you know better. So if you don't know better, you can't do better. And so I think the people who realize that there were issues, and people maybe didn't know there was issues, now they realize that, oh my God, this is what's going on. So after all this said and done, we realize that there is a great need for us to help each other. And that's what I do love about that. So we really need it, and we need to really stay home. If we can stay home, and we have to mask up. I think, as we say, we have a stay home order. We need to have a mask up and glove up order. I know there are some states that you have to have gloves and masks. I think it should be mandated for Mississippi to do the same thing. I don't know what the cost will be, but it should be that way. Also, I think we know we're getting these stimulus checks out and this money out, but I think we need to really work on, when this is all said and done, to talk about financial literacy. When we get a time of crisis, how do we manage what we have? Because I think a lot of times, I was listening to a show and they were saying about, we make the tissue here and the paper towel, so we don't have to go out and buy it. A lot of things that we manufacture here, the other countries, they did it because they have to get it from us. But if it's already here, we don't have to scramble to go get it. So a lot of things that I think we just not educated on to know that it's already here. We don't have to rush to get it. So that we need to provide support in our community and educate our community. These are things you don't have to get if we stay home and just let COVID-19 run its course. We can all get out earlier. And then also our leader, our infamous leader, our country leader, if they can all work together and work hand in hand, it can be a better United States. It really can be. We have to, another thing I watched this morning, we were in Florida. They threw out all these crops of corn and vegetables. So they said they had a surplus. We have to learn how to communicate more effectively as a country, because they say, well, the schools closed down, the restaurants closed, we didn't have where to give it, but there are food banks begging for food. And then people are throwing stuff away, and that's Florida, which is not that far from, Georgia and Mississippi. And then they had the dairy farms in Wisconsin poured the milk on the ground, saying we don't have anywhere to give it. So we have to find a way to communicate. But then they are now about to ship the watermelons and all the summer vegetables from Mexico, which we just not communicating. So we have to learn how to communicate more effectively and be more, efficient with things we do have, with the resources. So I kind of think this may be a wake-up call for us, to make us realize that we have a lot of resources in our country, that we all work together. We have enough for everyone to share.
Yulanda, thank you again, friend, for joining me. I very much appreciate you taking the time to talk with us today. And as you've highlighted very well, we all need each other. And I hope we can continue this conversation about how to improve outcomes for everyone, especially those who seem to be so disproportionately impacted by this crisis. You hit the nail on the head, I think, when you talked about leveraging what we've learned from this to move forward. We don't need to talk about going back to normal. We need to talk about moving forward and being better and doing things differently as we go ahead. And I'm really excited about that prospect too. I think you're right. We've got a new sense of unity, and a new sense of we're all in this together, and that is so powerful. So thank you again for sharing with us today. Now, viewers, thank you all for joining us. And I'm sorry again for the technical glitches. I appreciate you bearing with us as we worked through that and came back to you. So please, like I always say, leave us a note in the comments with what you learned or with ideas about how we can do these lives, these Facebook Lives better, topics you want us to cover. Let us know what you found helpful today. And as as always, like I always say, I encourage you to stay vigilant and stay healthy. Join us next time.
Thank you.